Hi, I'm Dr. Tanzman from Chau Plastic Surgery. This is an informational video about JP drains. Our patients will have JP drains when we do large surgeries like tummy tucks or some sort of breast surgeries where there's a skin excision involved and then space where the body might have some swelling. This part of the drain, this is what a JP drain looks like. This part of the drain, you can see these little holes. This is what would be underneath your skin. The idea is that the fluid will go into the drain through those little holes and get caught by the grenade or the bulb, as we call it, on this side. We always want this bulb to sit decompressed because this is what creates a negative suction to draw the fluid into the bulb. You'll be instructed to record the amount of output every single day that comes out of this. And we typically like people to empty it when it gets to this first line. So the way you tell how to do this is you release the little cap at the top, allow the air in, and then you'll see where the fluid lays. We'd like you to empty it when it gets to about this mark, and that's about 25 cc's. The way you do that is you take the cap off, and then you squeeze and empty it into the toilet or a bowl. And then you always want to re-engage or squeeze the little bulb back down and put the cap back on. And you always want it to look like this because that means it's working. You'll do this a few times a day for the first few weeks when you have a drain, and then it may get less as the weeks go by. We will also want you to milk the drain because we do not want these little holes to get clogged. So in doing so, you'll be instructed to take an alcohol prep pad, open it, and this is just so it slides well. You'll find where the drain exits the body, and you'll want to use one of your fingers to hold it while the alcohol swab pinches and slides towards that bulb. And then you just follow it away from your body all the way down to the bulb. And what it's going to do, it's going to push the fluid that's in the drain down into the bulb and create extra suction for it inside your body. And you want to do that 5 to 10 times a day. That doesn't mean you have to empty the drain 5 to 10 times a day. You may only empty the drain 2, maybe 3, maybe 4 times. But we want you to still milk it throughout that time, about 5 to 10 times a day. Once again, it helps to prevent these little holes from getting clogged. We also will provide you with a piece of paper, so all this is in written format. And in here, there's also a chart. And the chart will help you record each time you empty the drain, and then a total for each day, and you'll bring these records with you to your office visit. Hope this was helpful, and we look forward to seeing you next time.